Hey guys, it's Dave. Today we're going to talk about otitis media, or middle ear infection or ear infection. Generally, you can get an ear infection in the inner ear, the middle ear, which is the most common, or the outer ear. Outer ear is going to be more related to actually the structure, the skin itself, where you can get an infection there, but it's more related to maybe getting a cut, a scrape in the ear. If you're putting in a hearing aid, you can get one like that. If you're a little kid, you're scratching ears, things like that. Otitis media is in the middle ear. And what happens is you get some inflammation, some redness, swelling, and a buildup of fluid behind the eardrum. And what can occur, especially for people that have a upper respiratory infection, a cold, allergies, the flu, or any kind of sinus infection, what can happen is you get the inflammation in the eustachian tubes and they become inflamed, swollen, and blocked. As this blockage occurs, then you start to see some mucus buildup behind that blockage. Mucus is a great place for bacteria. They love mucus. So then bacteria gets exposed to that mucus and you develop an ear infection. Now, with this, again, like I said, you're more prone to it after you have a cold, allergies, flu, upper respiratory infection, things like that. But you are also more prone to it if you have a family history of ear infections. That's probably related to the fact that your eustachian tubes are very much built the same way as mom and dad's eustachian tubes were. So that's where you're looking at the physical makeup genetically being based on that. They are not contagious. However, the situation that you get one in can promote ear infections in other individuals as well, especially in children. As far as risk factors, the main population that you see these in are young children, 6 months to 2 years old. Those kids, if they're in daycares or preschools, as they get a little older, they're going to be more prone to it too. If they have immunocompromised systems, so if they're already infected with something else, if they already have maybe COVID, the flu, things like that, if they're going through cancer treatments, those kind of things where their immune function is already compromised, they're going to be more prone to ear infections too. The Native American, Alaskan Native, and Hispanic populations are more prone to them than other races, as well as patients that are in a smoke environment. If you have smokers in your house or you're exposed to a lot of secondary smoke, you're going to be more prone to ear infections. Other populations that you look at them in are going to be populations in smog situations, or in the case that we're starting to see almost every summer, if you're around a lot of wildfires, you're going to be more prone to getting an ear infection. As far as symptoms, pain, redness, itching, trouble hearing. Also, you're going to feel like a fullness or where you're hearing like an echo within your ear. That can be from an ear infection. Trouble sleeping, as you're not getting comfortable and the ear feels full. Dizziness can actually be a side effect of it. Decreased appetite, especially in young children. In infants, you're also going to see an increase in crying. Snoring may occur. As those tubes get blocked, everything gets compacted in the nasal cavity. You can see an increase in snoring. You also most likely in younger children will see fever as well. Something that everybody can see is drainage. You especially will see it at night when you're laying down. You may see some drainage out of there. If it is white or kind of pussy yellow colored, you may actually have a ruptured eardrum situation in that. In that case, get in to see a provider right away. You may need something done extra with it. As far as treatment, most ear infections will go away on their own. However, for the pain that can be associated with it, over-the-counter ibuprofen or Tylenol are fine. If you have the ear infection is bad enough, you go in to see the provider, most likely they will give you an ear drop with an antibiotic. Sometimes, if it's really inflamed within the ear, a steroid will be added to the antibiotic as well. Generally, it's going to be a short term, anywhere from 5 to 10 days, maybe every once in a while 14 days. As an adult, they may not give you an ear drop. They may just put you on an oral antibiotic instead, and that's fine. As far as other things that you can do, if you're noticing the dizziness that can be associated with it, they may give you a drug like meclizine to help out with that dizziness and instability that you're seeing there. Guaifenesin, or just straight Mucinex, can help with that clogged ear feeling that you're getting. Just like it clears the stuff out of your lungs, it helps clear the mucus in your ear as well. So that's something you can try. As far as complications that you can see, really there's not many, but you do have to watch out if you get a severe one. You can see hearing loss. Generally that's just temporary unless you get a severe infection that affects the inner ear as well. You can, in little kids, see slowed speech development if they have extended inner ear infections where they're just not going away. If that's the case, hopefully your pediatrician will be looking at doing something to help out with those, like within the eustachian tubes themselves. They can do surgery to help out with that. Now, with the hearing loss that you're looking at, the slowed speech development, that is for extended periods of time with inner ear infections or ear infections. You can see the spread of the infection, which is rare, but if it is severe enough, where you can develop mastoiditis or meningitis. So be aware, especially if you're running a fever, your child is running a fever for a long period of time, get in to see your provider regarding that. A ruptured eardrum can occur with that as well. That's the oozing that I was talking about, white or pustulant yellow oozing. If that occurs, get in to see your provider. Now, for some tips to help prevent ear infections. Number one, if you breastfeed through 6 months of age, that will help. There are antibodies produced in the mother's breast milk that will pass on to the infant to help reduce the risk of ear infection. Second thing, if you don't breastfeed but you bottle feed, make sure you're bottle feeding your infant in an upright position. That will make them less prone to ear infections. Also, very important, keep your child away from secondhand smoke and yourself, because adults can get them too. But the more that you're exposed to secondhand smoke, the more likely you will be to get an ear infection. And remember to make sure that you get a daily vitamin in your child and yourself every day to help keep your immunity built up to help prevent your ear infections.